Hello, I'm Shannon Brinker. I want to welcome you to Mastering Rubberdam Placement. Today we're going to go through a lot of information when it comes to placing Rubberdam. And one of the things that I want to let you know from the very beginning is we also have a downloadable PDF that will walk you through all the different clamps that are available. Today we're going to talk about a lot of different materials, and so at the end of the day I really want you to be able to have access to all the different companies, the instrumentation we're going to be using, but most importantly, different types of clamps, and we'll talk a lot about that a little bit later. But I always want to encourage you to make sure that you go through the learning module and download any handouts and any guides that we might add to this. And so without further ado, let's get started. When we talk about methods of isolation, there's lots of areas, and we have a complete course on isolation devices. This is all on really focusing on Rubberdam, and for those of you that are already placing Rubberdam, this is just a refresher, but there's also a lot of assistants out there that have never placed Rubberdam. And so when we think about, again, all those different methods, when we talk about isolation, of course we've got cotton rolls, we have, HVEs, we've got isolation devices, mouth props, cord, all those things. But at the end of the day, the only real isolation device that's going to help us to not, have the patient aspirate anything that we're utilizing in the mouth, and that is going to be the Rubberdam placement. I always want to talk a little bit about that potential harm, and I think that this is where and why a lot of practices more and more, especially on the pedo side, are actually utilizing more Rubberdam placement, which is why you're probably taking this today, is that you want to learn more, because the last thing we want is to be having to take care of an emergency right in the middle of our prep, and most importantly having anything that could happen to our patients. And so these things do happen. We're not perfect, but at the end of the day, I think when we talk about why are people not placing Rubberdam, there's a lot of advantages, but there's also some disadvantages. When we think about the advantages of Rubberdam, though, the first thing that we think about is, we can protect the patient. We don't have to worry as much about that potential harm. We also want to make sure that, we can see. I think this is something that we'll talk a lot about in our isolation courses, and a lot today is really based upon the visibility, not just for the dentist, but also for the dental assistant. Because our eyes are always on the patient, and anytime that I can place a Rubberdam, I'm going to do that. But I feel like the reason we don't place it enough is because we're not really properly trained. There really was only one person many, many years ago, Mary Costello, really set the stage for us, and she did a lot of Rubberdam placement with Colteen Weldon. And really, I always give her credit, because I would know nothing about Rubberdam placement if she had not paved the way for me. And this does improve efficiency. Again, everything in dentistry is repetition. Once we get it down, the clamps that you're going to use. We all are going to have preferences to clamps. But I think what we want to make sure of is that we make it super simple for us to be able to place it. But the great thing about having our CE in a box is that, you're going to have everything to practice. There's no way that you're going to learn this right out of the gate, and most importantly, being able to perfect it. So we're going to have to, again, going back to watching the modules is why we put them together, and most importantly, having the hands-on component. The disadvantages is that it does take a little bit of time. Really less than 7% of the population even place Rubberdam right now in the office. But again, it goes back to the training. And so congratulations to you for having that. I think this is where, again, I always say, if you want to be the best assistant you can be, you've got to invest in time for training. Patients sometimes will, object it. There's a lot of patients that don't like placing Rubberdam, and I think that is because we really did not explain to them why we're utilizing it. We want to protect you. We're going to place Rubberdam. We find that patients really appreciate it. You don't have to taste our chemicals, because everything in dentistry tastes bad. And actually, my husband loves Rubberdam. He really does. He would rather have it any day of the week. And I think that it helps us to control the water, control those patients that a lot of times are right in the middle of our bonded procedures. They're coughing, they're wanting us to suction at the worst time, right? And so again, teeth that, the hardest thing with this is teeth that are not super erupted. We're going to talk about those, clamps for that. Third molars, more and more people in this day and age are actually have third molars. They're not having them extracted the way that most of us used to recommend. And malpositioned teeth are really tough. And so we're going to go through that today. The other thing is I will tell you firsthand that I have had a patient actually have a panic attack when we placed a rubber dam. So you really want to make sure that those patients are not claustrophobic and they understand what we're doing. This is really, really important. And we're going to get through this and talk a lot about making sure those patients who have asthma, maybe have sinus issues. I'm one of those patients. How do we make sure that they understand the breathing techniques once we place it? This is a conversation we have to have. So what do we need? Well, we're going to need a lot of materials, but this is what you're going to be utilizing in your hands-on kits. For those that have it, we're going to have rubber dam material. We have clamps. We're going to use a really nice hole punch. We've got our forceps. We want very sharp scissors. And you actually have new scissors in your kits from Pascal, which are amazing for those of you that have our hands-on kits. We're going to use floss, and we want to make sure we have a good frame. And we're going to go through all the different options that are out there on the market today. And really, again, having some of these samples in your hands-on kit is going to allow us to really try some new products as well. So let's jump on it. Here, first, we want to talk about rubber dam material. It comes in different sizes. We've got 5x5. That we're utilizing a lot of times smaller sizes for anterior application and also our primary dentition for our pedo patients. The 6x6 we're going to definitely use on our adults and also for posterior. In our practice, we don't really see any kids, so we just have one standard size. But one of the things that I do want to talk about are the different thicknesses, and we all have our favorites. We have thin, which is usually recommended. And the reason I'm breaking this down is because at the end of the day, you're taking the course for a reason. And I want to make sure you understand what is the difference between the thickness, because I can tell you as a new assistant, no one ever explained to me about the thicknesses of the rubber dam and really why do we have those thicknesses. Well, the thinnest is always recommended if we're doing endodontic procedures, because a lot of times we're only using one hole punch and we're not having to punch holes for all the other teeth. But the thin is going to be something that, could easily tear as well. That's why I think a lot of times the thin is really recommended for endodontic isolation. The thinner the dam, again, the easier it is for us to apply it, though. So a lot of times we see some practices that really love that. It doesn't retract the soft tissue as well, which is why, again, we're not really using it for, quadrant dentistry. And also, I've got really good friends that actually use the rubber dam for preparation design. So this is why I want to make sure you understand the difference in the thicknesses and when to use them. When we talk about medium, that's really, it's used really because it's easy to manipulate. I will tell you that most practices do like the medium or the heavy, but for me, I like the heavier thickness because it's really recommended for restorative procedures. Anytime we're doing multiple units, the one thing that I like is being able to stretch over the teeth, and I like to bring my rubber dam to the midline. I don't just do a single hole or two hole. I like to bring it all the way to the midline because I feel I have more control over that isolation area. And my doctor likes to do a lot of quadrant dentistry, and the last thing that I want is have to remove the rubber dam clamp because we've got areas that we can't get to. So I want to make sure that I like to use the heavy, and that's really what you're got samples of today, but you also have some samples of the other ones. Comes in different thicknesses. The extra heavy really is where that tissue, we talk about, for bleaching, I'll use this more for retraction techniques, and super heavy the same, right? I will say that my doctor, though, is now utilizing more of the black. We used to use blue and green, but now we've got this beautiful black, which we've got some samples of for you on behalf of Cranberry. So thank you so much, Alan Wong, for giving us those. But you've got some samples of that. And so the black, I feel, is really cool. It really is a great contrast for me, and I love the visibility. And in these kits, you actually have also a nice little guide. And so for me, I utilize a lot of Hufridi, which are great products. Now I utilize a lot of Kulzer products, which you'll see, and but I am using now, I'm switched to the Cranberry Carbon because I love the black. Now, again, and gray is really an alternative for the black. Some people, and when I say that, some doctors don't like the black because of the reflection, so they do like gray, but I find that sometimes that gray is a little bit hard to find. Transparent, some of my friends who are endodontists like transparent because they like to be able to see through and have more of a view for clinical field. For me, it is very distracting when we talk about aesthetics and on the restorative side. But I just want you to know what's available. I think that's really important. And we just kind of put it into a slide so you'd know without having to flip through the slides, just the different thicknesses. And again, what do those look like? Because as a dental assistant, we want to make sure that you know, and again, this is a lot of information, but I want to make sure that if you're writing questions, you don't have to worry about it. It's all in this program. Now, there's a couple of ways for us to make sure, because I will tell you, there's a lot of videos. I'm going to share with you one of my favorite speakers. It's the Bellegrade Academy. You'll hear me talk a lot about Bellegrade Academy. I learned a lot from them when it came to Rubberdam placement. I also love Dr. Joey Pop. You'll see his information at the end of this course. He is the Rubberdam expert. And let me tell you, his courses are absolutely amazing. If you love Rubberdam placement, that's the next person you want to go to, because he is the guru. But one of the things that a lot of people don't do anymore, especially when you're a doctor that's used to placing Rubberdam, I see a lot of them not using guides. And for me, I want to use a guide. Why? Because I want to make sure I have proper spacing in between the teeth. This is where I think this is really important. You don't want to just guess and eyeball it. And some of my friends will actually place the Rubberdam on top of the teeth, mark it with a marker, and then poke the holes. Where for me, I want to play it safe. I'm a safety person, right? And I also want to get on with it. So I will pre-stamp, or you can use a pen and use a stamp for this, or use a little guide
to really demonstrate here where are we working first, and how do we identify where we're going to be placing our clamp. So if I look at the key guide and I think about it just like this is pretty much what we're going to be doing today. So I'm going to just kind of show you how easy this is. I'll take my Rubberdam here, and I'm going to just place my key guide right on top, okay, just like that. And I'm going to use my pen. And I'm going to be making a pin mark, because I know that usually the last one is going to be for what we call wisdom teeth, but I'm going to go ahead and use that anyway for my anchor tooth. And I love using these little guides. Sometimes I'll go ahead and actually use the guide and make marks on all of my little Rubberdam in my box, so this way I'm really prepared at any given time for us to place the Rubberdam. So instead of really just trying to pull this out one at a time and use my pen to make the marks, I go ahead and pre-mark them. Just have them ready.
And again, if you have a patient that cancels, this is a great way to pass the time. But a lot of my friends, including Mary Costello, she liked to use the hygienic, the Dental Dance stamp. And you can just go ahead and pre-stamp them all, and they're all ready. The other thing is that, you've got a guide. You could also use chalk. A lot of people like that, where they don't have to use a pen. Here, I was teaching a course for Cranberry, and I just used some chalk and just marked it. Boy, it was really fast, right? You saw me trying to take that pen and just do 1 tooth at a time. It's like watching paint dry. And so if you've got some chalk, you could just do the chalk really fast, and that takes seconds. So, again, just want to give you some options. Let's talk about frames. There's lots of frames out there. We all are going to have our favorites. You're going to be utilizing the metal frame from Hugh Freedy today, and Colzer. You've got one or the other in your box, but there's also some different ones. There's one that is a plastic frame. A lot of endodontists use this because it's radiolucent, and it's more of a round shape. We also have plastic shape frames. It just depends on your preference. The reason that I always use metal, and again, today I'm using my Colzer, because of the fact that it actually comes in the kit already, and I'm just used to it now. But it just depends on your preference. No way or the other. It really doesn't matter to me as far as what you like. You'll also notice that the prongs on your Hugh Freedy frame are very prominent versus the ones that are on this plastic shape. So again, just making sure we don't use that to pierce the patient's face and use our hand as a fulcrum on their face. Sometimes my doctor would do that, and I'd be like, don't forget that you're pushing a hole in there, so be careful. Let's talk about hole size and hole punch. One of the things, first of all, is always make sure that when you're punching your holes, you've got a really good hole punch. And you do, because the one that you're utilizing is brand new for those that have the hands-on kits, and you'll see that plunger is really sharp. I used to think, and again, I'm always going to tell you the truth. I'm never going to lie to you. I can tell you that Shannon always tries to find a fast way of doing things. I will. I say I'm being very efficient. And as a new assistant, I thought, well, the largest hole, shoot, let's just get on with it. Let's poke every hole with the largest hole, not knowing that the saliva and blood and anything else that we are having as far as fluids go would come right up through those little areas. Really, the largest hole is very important to understand that really is just for our anchor tooth. So don't be like me out of the gate, which the great thing is you're taking a good course, punches the hole through the rubber dam, allowing the crown of that tooth to stand out. And that's what we're going to use, and we're going to talk a minute about the sizes. The largest hole is always for the anchor tooth, and the anchor tooth really only, unless the patient has a bedrock tooth, right? A punch precision instrument, making sure that we have a really good hole punch. And when you do punch it, make sure you clean out the rubber dam that's in it. A lot of times we'll see those little pieces of rubber inside the holes. And again, making sure that nothing is going to inhibit us to have a really clean hole. And so a punch precision instrument, really having a rotator, we call it a metal table, or a disc with 5 to 6 holes. And again, tapered, very sharp. So again, be careful when you're doing this, especially out of the gate. Those hole sizes, we've got that number 5 is what they say. Number 5 is the anchor tooth. Number 4 is always going to be for molars. So if we're placing a clamp on a molar, for that, we're going to go forward, number 4, and then as we move to the midline, it gets smaller and smaller. And so number 3 is going to be for bicuspids and cuspids. We're going to have number 2 for their maxillary anterior, and number 1 is always for mandibular anterior incisors, okay? So again, we want to make sure you're moving up. Don't be like me and just think you could hurry up and expedite it by making everything the larger size, because we've got to protect the gum tissue. And sometimes when we get in there and we're flossing interproximal areas, or we're inverting the dam, we can cause a little bit of bleeding, and I don't want that to creep through. So again, making sure that that dam is secure, and we'll get to that part here in just a few minutes. The one thing that I also see a lot of team members omitting is an oral shield. Oral shield, basically, I use for whitening. I'll place it around my rubber dam or my intraoral device to keep the teeth separated, even for whitening. I love using these, and I don't even think there's any competitor out there on the market. This is from Hygienist, and this acts like a cushion between the rubber dam. And when I told you, some patients will actually salivate more, slobber will start creeping through. And so this really acts like a cushion between the rubber dam and the patient's skin. And it's really just a cushion, and I love these. It really prevents that skin contact too, because remember, some of the rubber that we're gonna be utilizing, some patients might not know that they have allergies to this until we put it on their face. So just make sure you're aware of that. You know, it absorbs any saliva seeping through the corners of the mouth, and most importantly, is a cushion, right? So if your doctor does use it like a fulcrum, like mine does, you might not pierce the skin as much. We talked already about that punch, and again, going back to this, and I just want to make sure that it's a clean punch. You know, I don't want to see a Mickey Mouse ear. I don't want any tears. And it really goes back to just taking care of our equipment. You know, again, utilizing these areas, making sure, and again, here's a second slide that Mary allowed us to use, just showcasing that, right? When we understand that size, we got holes that must be punched for those following arches, smaller holes, again, going back to this, just to remind you what I just said. Sometimes we have to hear things a couple of times, but again, if you're gonna be conservative, some doctors will say, I only want 3 holes. That's fine. It really depends, but I will tell you that for me, I just found that when my mentor, Dr. Ron Jackson, told me, Shannon, bring it to the midline, you'll always have better control of your rubber dam. Don't stop with a 2-hole or 3-hole. I started doing that, and he was absolutely right. And so for me, once we did it and I started doing it and getting easier and easier, I never stopped. When we think about forceps, though, I see this a lot, is, you know, one of the things we have to do is we want to not lose our clamps because they're very pricey. But the one thing that is really sacred are the clamp forceps, and I see a lot of assistants leaving the clamp on the forceps and actually autoclaving it this way. I don't do this with my rings, and I don't do this with my clamps, because you are really wearing out the spring of the forceps when you do that. I will tell you, I've had the same forceps in my practice and in my teaching for over 15 years now. I've never had to replace them. If you take good care of them, you won't. They'll last your whole dental career. And so really these forceps are helping us to engage. We're not going to use the same forceps as we would for the ring. These have to have prongs that fit right into the clamp, and making sure that we have really good control, because if you try to use your forceps, and I've had assistants try to do that, for your nighttime rings or your palatal matrices, your sectional matrix, as you go to put that clamp on the tooth, they're going to pop out, and it can be dangerous. So you just don't want to make sure you're using the right one, and don't get them confused. And we have another module on that for new assistants to help them understand. But again, you want to identify the clamp that you're going to use, and we're going to get to that here, and I want to help make it simple. Some of the other items, though, that you might need for placement would be, again, going back to the floss, and I know that sometimes the floss, I like to have a really good, I love Glide floss, but I know that somebody told me they might be going off the market. Having very sharp scissors, surgical scissors. The scissors that you're using, if you have our hands-on kits, are from Pascal. I absolutely love those. I mean, they really do cut well. Some people like to wedge with wizard wedges. You have some samples of this. This is basically almost like little Rubberdam material. It's just maybe rubber to place in between to hold the Rubberdam in place instead of using floss. It really and truly is up to you. The other thing is that sometimes I'll use topical, not KY jelly, that's old school, topical on the back side. So if I punch a hole in the side that's going to go on the patient's tissue, sometimes using a topical or glycerin will help us to stretch the Rubberdam over the area faster. But I can tell you, at my age now of placing so many Rubberdam, I don't even need that anymore. And you won't either. The clamp selection. Let's talk a little bit about the clamps. You want to make sure you have one. It's almost like Goldilocks and the Three Bears. You got to have one that's just right. That selection is very important. And this is where, again, right now in the dental industry, there's probably over 200 to 300 different clamps to select from. But if the clamp is too large, it will impinge on the soft tissue. And as the patient starts to wake up, after the doctor's anesthetized them, their tissue is going to really be sore. And I've seen tissue look like ground up hamburger meat. You got to be really careful. The other thing is that, you want to make sure that that clamp is not too small, because as we go to properly place it on the tooth, it can pop off, and it can be unstable. So that's something that, again, you want to make sure it's not too large, not too small, just right. Okay. The other thing is that, we identify these clamps by numbers. There are two different types of clamps. We have what's called winged clamps, and then we also have wingless. These are a lot of times our preference. All of us are going to find the clamps that we really love the most. But what we really want to think about is the bow of the clamp is always positioned on the distal of the tooth. An A following the number, and this is something I didn't know out of the gate, was really the A following the number identifies the clamp with subgingival claws or jaws, right? I call them claws, jaws. So this is where, again, having the diagrams that we talked about, and you may want to you download those even before you have, go right to our hands-on after this course, just to make sure you have it. And what I did was, again, I have it here on the slide just to give you an idea of which tooth numbers really ideally fit the clamps that are available this day and age. And in your hands-on kit, we didn't give you every clamp. We gave you the ones that we would be practicing with, but you've got a Hugh Freedy guide that I uploaded, you've got a hygienic, and you also have a Kulzer. So this way you can kind of look and choose. Again, I just want to make sure that you've got everything that you need to make the right selections, but we'll find that we're going to have ones that we really like more than others. So we're going to kind of switch off a little bit here. Let's talk a little bit about clamps, and my screen's going to be a little bit of a different color because I wanted to highlight in the diagram exactly where are these teeth clamps going to be placed. And anterior is always easy, right? We can use the anterior. We use a double bow clamp, a number 9, and that's really my go-to for just about everything. Again, it just depends on what you like. Some people like to grab that anterior clamp inside. You would see that with the doctor from Belgrade Academy. I like, and again, I'm cautious, a little bit more cautious. I like to have the ones with the holes. So I like to place my clamp right inside there. I don't want to have to separate something. And the reason being is because I did have a clamp one time pop off the teeth. It just scared me. And I just said, you know what? I'm not going to do that. I want to be cautious, and I want that forceps to fit right into those holes. And that's what you have in your hands-on kit. So these are going to be utilized for anterior. Now, when we get into our premolar area, we're going to use small flat-jawed clamps or curved jaw clamps. And these are what we're using for maxillary premolars. And we'll talk about mandibular here in just a minute, but maxillary really is what I'm utilizing And these are really, again, can be, my doctor loves W1s and W2s. They could, again, different numbers. So I just want to make sure, and this is why I wanted you to have a visual, not only from the top of the clamp, but also to see what it looks like underneath. And again, this is where you're going to have to try them in, and you're going to have to see which ones you like the most. And I can tell you that, we utilize a lot of premolar clamps when we're placing Rubberdam for preparation, and also what we call a slit dam technique when we're seating our restorations. And so we'll show you this a little bit later. But again, we're going to use smaller clamps, flat. I like the flat. And then anytime I can use a flat, I'm going to use that. And these, again, for the premolar areas. When we get into the mandibular molars, we're going to use, again, I like flat. Today you've got the 3, or what we call the W3. And then you have a number 7, which is my favorite. I use number 7s quite a bit. Anytime I possibly can, and it's my favorite one out of all the clamps. It's the one I use the most. And so, again, just really, trying them out and knowing. But again, it's not a one-size-fits-all, because these patients are going to have different shaped teeth. They're going to be rotated more than others sometimes. And most importantly, this is something that you're going to have to, again, practice, right? And that's what we're going to be doing today. So, getting to our partially erupted. I had to put this in the box because I wanted to make sure that you knew exactly about the partially erupted teeth, because this is where it is the biggest pain in the royal rear. This is why a lot of times practices say, I'm not placing Rubberdam. Anytime they see a partially erupted tooth, they're not going to do it, or a tooth that's even broken down. This is where I do and will say, looking at the YouTube videos from Belgrad, and again, at the end of this program, I did add a section of all of his videos because they are amazing. And what I love about the Belgrad Academy is that they're just 1 minute. They're easy, fast, quick tips. And he really does utilize a lot of different clamps than I do. And I learned a lot about, teeth that were broken down like this, but most importantly, partially erupted teeth. So again, something to really think about in reference. And I just wanted you to have it. But we've got 8A, a 14T here, 14A. Again, a W14A is what I'm also using mainly for those partially erupted teeth. And some people like to use those that have the claw. And when I say that, the serrated jaw area, I am not a big fan of serrations. And the reason that I'm not a big fan of those is because of the tissue. When we think about third molars, though, we do have to have something to grasp onto. And a lot of times they're not, it's really the hardest tooth in the mouth to place a clamp on. And so, I don't see this a lot. I don't utilize it, and that's why it's not in your kit for those that have the hands-on portion. But for me, again, I really do want you to just understand what clamp is for what, and this is just for your knowledge. The one thing that is very important, crucial, is always making sure that anything that we're placing in the patient's mouth, we're ligating it. I never want to be the reason why a patient swallows something. And again, even though, we're taking the clamp, we're placing the clamp on, we're placing the clamp off. Remember, I don't do, and we're going to get into this in just a few minutes, I don't place the clamp and the frame all at one time. And so we're going to ligate it.
I'm going to be using my anchor clamp, and I'm going to be using a molar. I personally like to use the number 7 molar clamp.
And I want to make sure it didn't play, but I'll show you this here in just a few minutes. And I'm just going to kind of skim through it.
My little loop through that, okay? And
I'll back up just a little bit. Sorry, I didn't mean to go through that. So we've got our clamp. Okay.
Again, my clamp only because I don't want a patient to swallow it. So I'm just going to take my little loop through that, okay? And just lasso this just to be on the safe side, all right? And I always do that, so this way if the clamp pops off, it doesn't go to the back of the throat, right? Then what I want you to really think about is where's the clamp going to go. So if I look here at the patient and I think about this tooth being prepped, I'm always going to go behind that one tooth. And I also want to make sure that you understand that the ring is always going to go to the back of the throat, just like that. So let's take our clamp here, and we're going to just place that right in. And I'm going to open it up. Now, I see a lot of assistants also leaving this like this when they put it back in the bag or go through the autoclave. You don't want to do that. You are really putting force on this spring here, and a lot of times it won't spring open like it should. So just make sure you don't leave it like this the whole
time. So we got that, right? We're going to place it. So now let's go into, again, placing it. Now, isolation, we're going to go ahead and we're going to determine which teeth we're going to be isolating. Posterior teeth, anterior. For posterior, we're always going to go at least one tooth to the distal of the tooth, right? We're trying to go one tooth being treated and extend to the midline if possible. Anterior, we're going to include those premolars to premolar. We'll get into that in a minute. And then we've got our single tooth isolation. This is for endodontics, sealants, and then we've got the pedo that we talked about. Let's talk a little bit about errors in rubber dam placement. The first error that I want you to really identify is, for me, this is one of those patients where they probably didn't mark it and they just punched a hole anywhere. It will be fine if it's just for one tooth, and maybe that's an endodontically treated tooth. But the one thing that I want you to really pay attention to for new assistants is, where is the top of that rubber dam? I mean, it's sitting right on the lip, right? I really want to make sure that it's not, and this could be for a reason. Maybe the patient, if they're claustrophobic and they needed some air or whatever, then yes, those are things to kind of think about. The other thing is again, I like to have that napkin. I think that's really important, so I just want to kind of touch on just a few errors here to make sure that you're aware. The other one is, when they are placing a rubber dam, some people will say, well, Shannon, do you wrap the rubber on the top? You wrap it on the bottom? I think it's really preference, but I do like the fact that they're really taking very good caution and precaution to fold it at the bottom. And you can see where what they did is just took the little corners that had a little bit of extra material. This is a number 6, and they just wrapped it to the center prongs. But the one thing that I'm going to back up that they missed is it's really covering the patient's nose. So here, a couple of things you could do. You could fold it under, so it's right under the nose, or you could even take your scissors and cut a little U, right? So just cut a little area there with some scissors, and I do that a lot because I like using a larger rubber dam size. So I just want you to see this and just kind of knowing what we're looking at here. Now here, all right, I don't want to talk about being cheap, okay, but I'm going to, all right? They're using a plastic material underneath the patient's rubber dam. Instead of using that napkin, they're using a piece of plastic. To me, that's dangerous. I'm sorry, but at the end of the day, I am not going to put a piece of plastic underneath this for a patient to aspirate plastic. And most importantly, I always wonder, what are patients thinking? Are they thinking that we're cheap? I mean, look, you can see it. I'm like, what in the world is that? They used a plastic baggie. I'm like, okay, I've never seen that before in my entire life. So hopefully you'll never see that again either, right? They didn't ligate the clamp. And most importantly, they've got glasses on the patient, which is very, very important. So we got to give them some props. But how about this one? Instead of, when they did the slit dam, they placed some material, which is basically bite registration material, to keep the material from going down the patient's throat and to keep it, again, I guess, isolated. I'm going to take you through how you don't have to do that, okay? The ultimate goal for me is not to have something like that is going to hold that area. But, I want, if you didn't see it, you'd never know. So I just want to make sure that you do, again, just see what's out there, right? Now, when we're punching this, we want to make sure, again, that the hole punch is in each of the rubber dam sheets always identified. So if you're going to pre-punch it, making sure you know exactly, the first hole punch is always, again, central incisors. You'll always do that first. This is something that you don't have to follow 100%, but I just kind of left it in here only because, when Mary was teaching me this, I thought this is a good thing to really just recommend, and going back to what she was talking about, punching the hole, mandibular first molars, mandibular second molars, and then looking at the bicuspids, and you're going to have all these slides. You can definitely go back. Okay, but we're going to lightly apply, again, the lubricant. I don't use KY jelly anymore. Sometimes I'll do that. This just really just helps us around the holes to make sure that on the undersurface of those holes, we can actually stretch the material. The rubber dams that we're using now are just so nice. We really truly have found I don't have to do that as much anymore. There's two different ways that you can place the rubber dam. You can place the dam first, then the clamp, or you can place the clamp and the dam together. Now, I can tell you that if you're super assistant, go right ahead. For me though, I like to play it safe. I always do. I always said this a million times. I like to place my clamp first, make sure it's all the way down, it's perfect, and then place my rubber dam on top. So we've got our guide, we've already noted exactly where they're going to be. We've got our clamp on, it's perfect. Never ever push that clamp down on the tooth. I've seen a lot of assistants that'll place the clamp and they don't feel like it's all the way down, they'll just push on it. And when you do that, those prongs are cutting into the patient's enamel. So don't do that. Make sure you ligated it right, remember, and we're gonna stretch the rubber dam up and over the tooth. And one of the things that we're hoping that you're going to do at this point is we're going to place our napkin, okay, around it first, and then place the frame. And then we'll put it right on top. I like to actually put it on top, and I'm going to stretch my rubber dam material on it. And some people, again, like to use that other plastic one. When you do that, though, just making sure you're going to drop a few, little droplets of water. I'm going to floss in between. And again, if you're going all the way to the midline, to make sure that there's nothing, no moisture, no water that can get down in there. And I just sometimes will test it. It's kind of old school, but the more you do, you won't even need to do that anymore. As we stretch it over the teeth, we want to make sure that we are going through each tooth and flossing, again, the inner proximal area. I like to floss, and what I even do now is I'll even cut a couple of pieces of floss while I'm sitting there, while the doctor's anesthetizing the patient before I place the rubber dam, and I'll go ahead and cut a few pieces of floss so I can just floss, leave it, floss, leave it, floss, leave it, which you'll see in the hands-on component, all the way to the midline, and then I will pull each one and then invert my dam. And when we invert the dam, how do we do that? We're gonna take an IPC or your cord packing instrument, for those that have the hands-on kit. And what we're gonna do is when you hole punch, you have a hole that's kind of tipped up. We're gonna take our instrument and we're gonna we call it inverting it. What we're doing is we're going to use our instrument to invert the dam around each tooth. So this way it's not sticking up from where we punched it. And again, all the way around each tooth, just envision you punched a hole and it's kind of sticking up a little bit on the tooth. We're gonna punch the hole and really push it down in these areas. And I'll show you that here in just a few minutes. What it does is it further seals the rubber dam, making sure that instead of it being just flat, it's inverted. Now, here what we're gonna do is we've got our clamps on. We'll take a piece of floss. We're going to ligate the tooth and making sure that our rubber dam, this is just another way to make sure that it's held safe in place. We have little mini clips after this to just go back through it, and taking the IPC instrument will kind of help us to just make sure that, again, we've got good stability on our rubber dam. And we'll do this a lot of times on some of the teeth that we're working on, but just be real careful not to make it too tight, especially if patients are not anesthetized in those areas. But this patient was, because we're getting ready to do some preparations on those front 4 teeth. So again, some doctors like to have a rubber dam for preparation, some don't. But we're gonna go through that and show you if this is a technique that you might like. The other thing is that I told you that whenever we are doing our delivery of restorations, another way of doing the deliveries, you can place some premolar clamps on the premolar area, those W2s, W3s, and we can actually, again, we're gonna remove the temporaries. We'll punch holes where they need to be, and then we take our scissors and we're gonna cut all the way across. I still punch holes for every tooth and then take scissors and cut it across. So we call this a slit dam technique, where nothing's in between interproximally. And we do this a lot. We do this almost all the time. We'll put a little 2x2, open it up in the vestibule, and then utilize our clamps for delivery. And I'll tell you, we don't have to place any of that bite registration in the palate, especially when we can go behind those clamps, just like we're illustrating here. But you'll be able to practice this, and it's part of our step-by-step technique. And again, showing this to your dentist, this might be the best way. I can tell you, patients don't taste the chemicals, they don't taste the bonding agent, they don't taste the etch. It really is great. Now, when we're removing it, we want to make sure we don't just grab the clamp, take it off, and just pull the rubber dam off. Have I done that in my time? Yes, I have. I would be lying. If we place wedges or any cords, we want to remove that first. We're going to stretch the rubber dam, again, remove it, stretch the rubber dam, cut it in between, then I remove the clamp. Some people will remove the clamp first and then cut. We'll just stretch it and cut in between each interproximal area, but just make sure that you don't forget any pieces. Rinse the patient really good, and then most importantly, wipe their face. Don't forget about that. There's a lot of other dams out there, and I want to just kind of showcase those. This is called the Instadam. This is from Zerk. It's another sample in your kit for those that wanted samples. This is really a very soft, very different type of rubber dam. I do like it. I'll be honest, it feels really good. They call it the relaxed dam. It's for single use. Can you use it for more? I guess you could. Maybe for single use, double use, but I'll tell you, patients really do like it. Very seldom do we do endo, but I'll tell you when we do, this is the rubber dam of choice. And it's very pillowy, so get a chance to feel that. The other rubber dam that I think is amazing, this one I use a lot for my infiltration techniques, for white spot lesions. Every time we're using Icon, I love utilizing this, and I will say that it is a great product. It's called the Optradam, and they also have one that is easy to use, and this is from Ivoclar Vivadent. You actually will have some samples of this as well. The one thing about this one though, it's already pre-stamped. I love that. You see this? It's already pre-stamped. It comes in one piece. It's very similar to the Optragate, and it is super crazy easy to place. Here, what I did is we're actually going to be doing some infiltration for my patient, and she's going to have the front 4 teeth in. I'm just going to kind of scroll through. You'll see here. The only downside to this one is you got to get up and over the little ring. It has an internal ring just like the Optragate, and you'll just punch these 4 areas, okay, or whatever you're going to do. It's great for quadrants. The one thing their claim is they say you don't have to have clamps. For posterior, you do. That's not true. You will need to do that. But for anterior teeth, if you're doing bonding, maybe you're doing some internal whitening, this is really an amazing product. And so I'm just going to cut this and skim through it pretty quickly, and you'll see me. This one it comes in a regular and a small. I always recommend using the small because it's got to fit just like this. But let me show you how fast this is to place. It is so crazy. By the time I had put fingers push pressure on the lingual, look, it's already popped through. Voila, we're ready to go. This is really amazing. Now, this is where I would probably do my ligation technique that we showed in the other video with my floss, because it will kind of creep down a little bit. And again, or even using some widgets, in between to hold it, maybe floss in between to hold it. But I love this. And so again, this is from Ivoclar. Get a chance to try this. There are some samples of it. The last one that I want to show you is the mini dam. This is brand new. I would say it's not been out very long, from DMG. I love this. There's so many things that are great with this, but I'm going to tell you what I use it for. I use it for sealants. It's so great for sealants. I mean it. It really is so easy. It protects the gingiva. It maintains a dry field. It's small enough. You can place it in seconds. And it's really easy to shape. And it comes in about a 20 pack, I believe now. But here's what it looks like. It is very small. You've got some samples of it. But let's just jump to the nitty gritty here. You're going to stretch it over the area. And again, it's a 2-teeth dam. Watch how fast it is, easy to place. You just kind of stretch it, pull it down, push, push, push. Super fast. You're done. It's crazy, right? I'm like, oh my God, you see, look on my face. It's so fast and easy. You will need to invert it. I didn't have any instruments here, so don't look at my ugly fingernails. But, again, floss it really quickly. This is such an easy thing. And again, DMG doesn't even talk about it. I'm like, what's wrong with y'all? I love this product. And again, you can use more than one, but it is so easy. And so if you're not really ready, or your doctor doesn't want to do rubber dam, right? And there's a lot of practices that don't, or we wouldn't be in that 6% range. But this is really great for sealants, just quick, fast, something. Maybe you're doing infiltration. That's why they designed it. I really do like this. And again, you can see here, now I'm going to pause it because you're going to have to see that where you really do have to, you see where I've got, again, that lower second molar here, and I'm going to freeze it. You'll see where you're going to have to take an instrument though and just make sure that you tuck this in. That's what we were talking about, inverting the dam. Using your Pascal cord packing instrument that is in your hands-on kit to invert this, and you'll also see me do that in the hands-on, but just flossing it. And again, you can use 2. I mean, they didn't even know you could do that. And I was like, I just use 2 as well if I'm going to do a full quadrant. I'm still a rubber dam girl. okay, all together. But for those of us that, again, may need something fast, quick, and maybe your doctor doesn't want to do it, this is a great alternative. So you've got some samples from DMG to utilize, again, in your kit, and I really do like it. So I hope you enjoyed our really quick step-by-step, and for those of you that have our hands-on modules, one of the things that's really important is to practice. It makes perfect, always. Checking out Belgrad Academy. Belgrad, I cannot say enough. You're going to see that after this course. You'll see the links to the YouTube videos. I've actually placed them in my top favorites. Subscribe to him. It's super simple. It's free, and you can get these little quick tips all the time. I also put in the Rubberdamology from Dr. Joey Pop. It is my absolute favorite. I'm going to tell you, I'm addicted. I used to hate Rubberdam, but watching him do it, it is such an art. This man is amazing. Get your doctor to purchase that for you if you're taking Rubberdam courses. This is really a great addition, but I appreciate all of our partners and everyone who gave us samples for you in the hands-on kits. And if you need us for anything, reach out to us, let us know. But download those guides and laminate them and practice. It makes perfect. Good day.